I would now like to invite Dr. Clara van Gulik, medical advisor at MSF Japan, to initiate this session by sharing her insights on the impact of COVID-19 on existing health infrastructure. Welcome, Dr. Clara.
Thank you, Aditi. Sorry, I'm just turning everything on here. Can you hear me all right?
Yes, we can. Yes.
Yeah, okay, that's perfect. Sorry, I just unplugged my microphone, so I was just checking. Yeah, thanks very much, Aditi, for the introduction. And I want to say good morning to those of you far west, good afternoon to some of you, and it's good evening for those of us who are on the eastern side of Asia. I'd like to welcome you to the final sessions of MSF Scientific Days Asia 2021. So I have the honor, actually, this evening of chairing this session where we will hear about the impact of the pandemic beyond COVID-19 itself. We have been hearing quite a lot about it already in the other sessions as well. But I think this is a topic that we can really all relate to, having probably been affected in more than one way or another by this pandemic. So we have a lineup of inspiring speakers presenting to us from Bangladesh, the Philippines, and Pakistan, and hope that you can join the discussion that will be moderated by Dr. Farah Hossain. She's our Deputy Cell Manager with MSF for this region. So I've been working with MSF for over 15 years now, both in the field and at headquarters as a child health and HIV/TB specialist. And the progress I've seen in global health indicators, as well as in the quality of the medical care that can reach more and more patients, even in remote or unstable settings, in conflict zones, lower resource settings, has been really impressive and really encouraging. And as we shifted from Millennium Development Goals to Sustainable Development Goals, we saw that decades of hard work has really improved maternal and child health, sexual and reproductive health services, HIV and TB care, and that was clearly evident. And in 2019, and I'm saying this as a pediatrician, but the number of deaths amongst children under 5 had dropped to its lowest ever worldwide. And maternal access to safe delivery, access to family planning, access to safer abortion care, all had improved significantly. Of course, there was much more to do to maintain that good progress, but instead, I think the question we're starting to ask now is, are we generally at risk of losing that momentum and that progress? Because the reality we're facing now is that while COVID-19 infection is continuing to claim many lives and hundreds of thousands remain in a critical condition in intensive care wards, the secondary impact from the measures to tackle the pandemic are also taking a massive toll on other health services and on people's well-being and lives. Suspension of clinics, reduced medical services, disrupted medical supplies, shortages of oxygen, hospitals being overwhelmed, stretched healthcare staff. These have all impacted access to health services in both resource-rich as well as resource-limited nations. And movement restrictions, border closures, lockdowns, school and university closures, job, income losses, the social and economic damages are also significant. And that's been reflected in increasing mental and physical health complaints amongst all age groups. In comparison to certain high-risk groups, the usual sort of vulnerable groups that particularly been paying attention, such as women of childbearing age, young children, people living with HIV, have actually mostly been spared from severe COVID-19 disease. But while governments and health services are struggling to respond to the pandemic and all its consequences, health advocates are warning us of a potential catastrophe to come if we don't act now to ensure that all that hard-won progress of the past decade is not in vain. And if I can refer to a report from the UN Sick Kids, it was joint report from the United Nations and agencies and Sick Kids Global Child Health, a study that conducted exercises comparing 2019 and 2020 maternal and children's data in this region in South Asia. The findings that were published in a report that was called Direct and Indirect Effects of COVID-19 Pandemic and Response in South Asia. So in that report, there was an estimated 228,000 additional deaths amongst children under 5 in the 6 largest South Asian countries, a 16% increase in maternal deaths, 3.5 million additional unintended pregnancies, and 420 million children that were out of school across South Asia. And more globally, there's a study that I'd like to refer to from Johns Hopkins that included 118 low and middle income countries that estimated an additional 2 million children under 5 could die in just 12 months due to the measures that were put in place in response to the pandemic. At MSF, we're also hearing the alarm bells and trying to respond to it. Despite the challenges of medical supply and staff shortages, travel restrictions impacting the mobilization of staff, MSF teams are working around the clock to provide care for COVID-19 patients, while responding at the same time to other medical emergencies and outbreaks, and having to adapt our usual sort of healthcare programs to keep them running safely and efficiently and accessibly. Yesterday, we heard from Dr. Parna from the MSF project in Mumbai, and she mentioned there was a 25% reduction in MDR-TB case notifications in comparison, last year in comparison to the year before, and how they implemented adaptations to maintain access to care for their cohort of MDR-TB patients. Now, the adaptations included, there are numerous, but included things like swifter shift to an all-oral treatment regimen, to putting in place teleconsultations, changing patient flow and crowd management in clinics, and enhancing infection prevention and control measures in outpatients to prevent COVID-19 transmission risk. In Venezuela and Brazil, and many other countries, and many MSF staff that were focusing on projects focused on care for survivors of violence, including sexual violence, had to be deployed to support the COVID-19 response. And on top of that, travel restrictions in these countries where access to healthcare was already a challenge made visits to clinics or hospitals in the pandemic almost impossible. So MSF teams have had to adjust their services to ensure victims of violence continue to receive the care they need. And also teams were set up to consult people at their homes to overcome access and travel barriers. And meanwhile, in conflict-torn countries with very fragile healthcare systems like Central African Republic, MSF staff are facing a double challenge of overwhelming medical needs for children that are affected by malaria, malnutrition, measles, and other outbreaks, while trying to, at the same time, to protect patients from COVID-19. So as health advocates and practitioners, I think we need to bring attention to the fact that it is crucial now more than ever to reinstate and support vital health services and to avoid the expected waves of preventable morbidity and mortality for years to come. So to do that, we need to understand the challenges faced by the various health services in light of the pandemic, what those challenges imply, what needs to be done urgently. So I look forward to listening to the insights, the experiences, and recommendations of the speakers of this session so that we can all together understand better and act on this now. Thank you, and over to you, Aditi.